Hey guys, am I audible, visible? If so, say me a hi, hello, good evening. So since I have covered the lab diagnosis of cancer also in the previous video along with the clinical diagnosis of cancer, I am now going to go with 24 patterns of neoplasia. Good evening, Lan. For the essentials batch students, I didn't talk about this. I gave this as a homework. I hope some of you must have seen through it. Good evening, Nag. If you've not seen, please use this as a chance to complete it, revise it, because this is a final touch. Like if I know about these 24 patterns, I can fairly say that the entire systemic pathology for almost every cancer required, I'll have an answer from this base, right? So before going to the 24 patterns, I want you to know what are the patterns and how we are going to use it for a day-to-day diagnosis, right? Can I say squamous cell carcinoma can happen in many, right? It's not just in skin. Can it happen in the oral cavity, in the esophagus, anal canal, cervix, vulval, vaginal, right? The multiple areas squamous cell carcinoma can happen. Am I also right in saying that in all these areas, squamous cell carcinoma will have the same finding? Good evening, Krishna. Yes or no? What do you think? It's squamous cell carcinoma. Will it have the same microscopic finding or different finding? Same finding, right? So if I know how a single squamous cell carcinoma looks, I can apply the same concept in almost every organ in the body. Any gland forming tumors, I call them an adenocarcinoma. So microscopy will more or less be the same, right? So hello Pratik. So what we are going to do here is we're going to understand 24 different microscopic findings. If you are new here, please take two pieces of paper. I want you to write down whenever I say something and please stick it in front of your study table, because this will give you a clarity like nothing else is going to give you that much clarity. Just 24 images, 24 appearances will give the clarity, or we'll give the PDF in the Telegram group. Take a printout of this and paste it, any one of it, but please do paste it. Fine. Now, uh, first thing is keratin pearl. Namaste Medico forever. So keratin pearl. So this is how a keratin pearl looks. So the way to identify keratin pearl is it looks like a whorl and it is pink in color, because keratin is nucleate or anucleate. Good evening, Vivek. Keratin. I want you guys to comment. Answer: keratin is nucleate or an anucleate structure? Definitely an anucleate structure, and obviously an anucleate structure will not have nucleus. That's why it's pink in color, right? So if you see whorls, keratin pearls, and this is going to be diagnostic of every squamous cell carcinoma from head to foot. When I say from head to foot, your skin, nose, nasopharynx, oropharynx, oral cavity, esophagus, lung, bronchus, respiratory mucosa, your anal canal, vulval, vaginal, penile, everything squamous cell carcinoma in microscopy will have the same keratin pearls. So if at all you are stuck, if you're a second year student and you want to write that, how if squamous cell carcinoma of lung, what to write? Same. The four features of dysplasia, which we read long back in the lectures: pleomorphism, high NC ratio, mitosis, loss of polarity will be present. Good evening, comprehend. Then you have the invasion, because invasion is must for every cancer. And then I want you to write keratin pearl. So this gives us a confidence, like if any cancer has been asked from head to foot, I can write the microscopic finding. Just keratin pearl, four features of dysplasia, invasion, more than enough. No one ever can tell wrong to you, right? This is what patterns of neoplasia does. Just 24 patterns, almost everything from head to foot we can cater, right? What does adeno mean? Can you guys tell me what does adeno mean? Adeno means gland, right? Adeno obviously means gland, right? So when you see a gland with the same four features of dysplasia and invasion, I call it an adenocarcinoma. Again, adenocarcinoma from head to foot. Good evening, Sagar. Any adenocarcinoma, salivary gland can have adenocarcinoma, oral cavity can have adenocarcinoma, lung can have, esophagus can have, entire GIT can have adenocarcinoma. Your endometrium can have, cervix can have, ovaries can have, right? Any adenocarcinoma from head to foot, glandular pattern, four features of dysplasia, and invasion. If I say it's an adenoma, can anyone tell me what will be the microscopic finding? Just extrapolate it. First, let's go step by step. Adenoma is benign or malignant? First, that question. Adenoma, benign or malignant? Definitely benign, right? So here, can adenoma also have glandular morphology? Yes, perfect. Will they have features of dysplasia? Yes or no? They won't. That's all. So when you see glandular morphology, increase in number, no features of dysplasia, it's an adenoma. So I know the basics. I can apply it in any place where you want, right? It's like cooking. It's simple, same ingredients. I use them in different dishes and different thing comes out of it, right? As simple as that. Next pattern for me is crib reform, nesting pattern. Nesting is, there's a nest. There's a nest, right? So I call something as nesting because I have an enclosed space inside which I have all these tumor cells, right? An enclosed space, I call it a nesting pattern. So whenever you see a nesting pattern, different organs, different diagnosis. I think of a carcinoid tumor. We will read about these tumors when we go to systemic pathology. Might be new names for you if you're an early part of your second year. Neuroendocrine tumor will have nesting pattern. Pheochromocytoma. This is a tumor in adrenal gland. Will have a nesting pattern. I have something called as paraganglioma. In your first year of MBBS, have you heard something called as carotid body? Yes. Can I call that as a sympathetic ganglia? I can. So I can have a tumor from the carotid body. I call it a paraganglioma or a carotid body tumor that will have the same nesting pattern, right? Or seminoma in case of a testis and dysgerminoma in case of an ovary. So how I'm going to use this information for diagnosis or solving an MCQ is, I know, okay, there's a 25-year-old male came with a testicular swelling. Microscopious nested appearance. My diagnosis is seminoma. 40-year-old male with an intra-abdominal mass arising from adrenal gland. Microscopy shows nesting pattern, pheochromocytoma. A 45-year-old person having a swelling in the neck arising from the carotid body, paraganglioma, right? History will be there in the question, don't worry. Or in real life, patient is going to tell you the history. Microscopy, I can easily say and apply, okay, this is the pattern of diagnosis, right? Next is small round blue cell. Nothing, it's just small round blue cells, that's all. Whenever you see small round blue cell tumor, before going to where all I'm going to see them, I want you to ask a question. It's small, round and blue cell. Is it immature or mature? Just tell me that. Just for an example, gland is maturity or differentiation. This is undifferentiated or it's differentiated. It's very undifferentiated, right? So a small round blue cell is an undifferentiated tumor. Any tumor with small round blue cell morphology will end with blastomas, neuroblastoma, retinoblastoma. We read in RB gene, right? Retinoblastoma. I have like nephroblastoma in kidney. Any tumor ending in blastoma, blast means immature, will have small blue cell morphology except two blastomas. Remember this, this came once in an exam. Hemangioblastoma and glioblastoma. Glio obviously in the brain, hemangio is blood vessel. These two blastomas will not have small round blue cell pattern. Rest every blastoma will have small round blue cell pattern. Any tumor with the name embryonal in it, embryonal rhabdomyosarcoma, will have small round blue cell pattern. Have a tumor called as an ependymoma. Ependymal tumor, obviously you know where it arises from, right? It obviously is going to come from CNS. Ependymal cells of the ventricle, small round blue cell pattern. Ewing sarcoma, which can happen in the bone as well as in the soft tissue. Again, small round blue cell morphology. One common finding, like Lion said, it's an immature tumor. So it's an immature tumor. It happens in younger age or older age. It name gives lots and lots of information for us. An immature tumor obviously is going to happen in a perfect. It's going to happen at younger age, right? Every immature tumor, every blastomal tumor will almost always happen at the first or second decade of life because they are immature. Has to happen in children. Retinoblastoma has to happen in children. Ependymoma, Ewing's, everything will happen in children only, right? Again, an information for us. Okay, papillary. If you remember our first chapter class, which all pattern will have papillary microscopy? We did read them when we read Samoma bodies. Yes. Where do you think it happens? Papillary pattern? Perfect. It happens in tumors with papillary in the name or tumors with serous in the name. And obviously they will have Samoma bodies, right? So that's what we read in Samoma bodies, the dystrophic calcification, papillary appearance, end of meningioma, perfect, or serous tumors. See, meningioma will be whorled appearance. That also will have Samoma, but not papillary. Papillary, serous will have papillary pattern, right? Amazing. Okay, next, cribriform. It's also named as Swiss cheese appearance. It looks like Swiss cheese, multiple holes in it. Whenever you see cribriform pattern, I want to think of two tumors. A tumor called as an adenoid cystic carcinoma happens in the salivary gland, and DCIS. DCIS stands for ductal carcinoma in situ. A ductal carcinoma in situ happens in breast parenchyma. Okay? It's a carcinoma in situ, right? Hi, Jaydeep. Okay? So this also will have the cribriform appearance in morphology, right? That's one pattern. Next, seventh, palisading appearance. So let's understand first what does palisading mean. Have you seen a fence? A fence palisades, which means it'll be parallel to each other. That's how a fence looks like, right? A fence palisades. Now, if you look at this nucleus, can I say these nuclei are more or less parallel to each other? That's what palisading means. So when I see nuclei parallel to one another, I call the pattern palisading pattern. Can anyone tell me which is the blastoma which didn't have small round blue cell morphology? Just now we saw, right? Glioblastoma and hemangioblastoma, right? Perfect. Of that, glioblastoma will have palisading appearance, basal cell carcinoma will have palisading appearance, and your schwannoma. Verroque bodies are finding in schwannoma that also will have palisading appearance, right? So a few examples for palisading pattern on microscopy, right? Perfect. Great. Okay. Next, cartilage. Simple normal cartilage, nothing else. There's a simple cartilage. If you see cartilage, normal mature hyaline cartilage, that itself is diagnostic for me. I think of a pleomorphic adenoma, which can happen in the salivary glands. Pulmonary hematoma, obviously, is going to happen in the lung. Chondroma, bone and the cartilaginous area, and teratoma. Because teratoma will have all three germ layers. For an undergraduate, definitely will give cartilage. That's like a minimum requirement. Even when you go to your slides in your hospital, they will show bone or cartilage in teratoma because that's easy to pick it up, right? That's what I want to think of when you see cartilage in a microscopy in a tumor biopsy, right? Next, oncocytic. So they say oncocytic, it's extremely pink and granular cytoplasm. A cell, a tumor with a pink granular cytoplasm, I call it an oncocytic pattern. One tumor is very simple to remember, oncocytoma, oncocytic pattern, obviously oncocytoma. Then I have fibrolamellar HCC, okay? Fibrolamellar HCC is a HCC, hepatocellular carcinoma, a subtype of it. And a tumor which happens in salivary gland, Warthin's tumor, right? This has an oncocytic appearance, pinkish appearance. The entire tumor will have pink color epithelium. It's easy to pick it up, fine. Okay. Then world. Can anyone remember world? Just now we recollected your samoma bodies. Tell me which tumor will have world appearance. I'm sure you guys can pick it up. World appearance. Two tumors with world appearance. One is your meningioma, great, and leiomyoma, uterine tumor, and both obviously will have samoma bodies, right? So both of them will have samoma bodies, meningioma and leiomyoma. Yes, Jaydeep, you're right. They will have samoma bodies. It's a world appearance, that's all. Okay. Next, when I see a spindle cell, whenever I have an elongated nuclei, I think of a spindle cell. When I see a spindle cell with a vacuole in it, I think of a tumor called as GIST. These tumors might look new for you. Don't worry, just 6 more months. You'll be expert of these tumors. GIST stands for gastrointestinal stromal tumor. Okay, it's gastrointestinal stromal tumor. That's a classical finding GIST, which can be seen in stomach and intestine. It's a stromal tumor, stromal morphology. Fine. Next, let's see this. Let's see this. I want you guys to tell me what this is. I'm just going to highlight an area. Tell me how does it look like. Can anyone tell me how does this look? There are two things you have highlighted. It's kind of circular with cells and the lumen here and that. How do you think it looks? Can I say it looks like a gland? Yes. So I have a gland here, which is obviously an epithelial morphology. And if you look at this area, it's all having elongated cells. Elongated cells, epithelium or mesenchyme? It's an mesenchyme, right? So I have elongated cells here. Any elongated nuclei has to be a spindle shaped cell and it's a mesenchyme. So this tumor has two things, has an epithelium in the form of a gland and a mesenchyme in the form of elongated appearance. So we call them a biphasic pattern, two phases, right? So we call them bi because they have both epithelium and mesenchyme, biphasic appearance. One tumor, don't forget in biphasic appearance, synovial sarcoma. This is important, can come in the viva for you or in an entrance exam. It's synovial sarcoma, which has a biphasic morphology, and fibroadenoma. See, it's there in the name. Fibro, mesenchyme, adeno, epithelium. Right? Fibroadenoma has the biphasic morphology, obviously, right? That's one. Okay. So we know 12 patterns. 12 patterns, we are done with it. Let's quickly go through all these 12 patterns and then we'll go to 12 unique patterns. It's very, very simple, 12 unique patterns, right? Okay. Keratin pearls, all these squamous cell carcinoma, glands for every adenocarcinoma, nesting pattern you see in case of a carcinoid, you see in case of a neuroendocrine tumor, pheochromocytoma, paraganglioma, and seminoma, dysgeminoma. Small round blue cell means immature, every blastomer tumor, everything in 1 or 2 years, embryonal in the name, again young, ependymomas and Ewing sarcomas. Papillary is nothing but your serous and papillary in the name. They'll have serous adenocarcinoma, papillary carcinoma thyroid will have papillary appearance. Cribriform, adenoid cystic carcinoma, DCAS, subtype of tumor in the breast. Palisade means parallel to each other. Glioblastoma will have, basal cell carcinoma will have, and Verroque bodies in schwannoma will have it. Simple normal cartilage based on the location, have few differential diagnoses. Oncocytic, extremely pink and oncocytic appearance. Watkins, fibrolamellar HCC, and your renal oncocytoma. Fine. Okay. Whirl, when it's whirled, you think of you guys have said meningioma or a leiomyoma, plus obviously some bodies. Spindle cell with vacuoles, just gastrointestinal stromal tumor. Two phases, both epithelium and mesenchyme. I think of a synovial sarcoma and your fibroadenoma, right? So these are the 12 patterns what you saw. Obviously, Sarah, the PDF will be available. It will be there in the Telegram group of PW or in my WhatsApp channel. Come anywhere, you can get this PDF, fine? Okay. Now we have 12 unique patterns. So I want you to remember these unique patterns as well. See, once these next 12 things are gone, perfect line. They do look the same, but you know the easy difference. Keratin pearl is anucleate, is pink in color. I'll show you the world. If you have any doubts, do ask me. That's a very valid question. Can I say world has nucleus, blue in color? Can you differentiate both? Obviously you can, right? Because world is nucleated, right? And obviously keratin pearl is keratin, which is an anucleated structure. So definitely you can differentiate both of them, right? Okay. I hope it's easy line, right? Let's go to unique patterns. Unique, the first unique pattern is perinuclear halo or fried egg appearance. I don't know, for the person who first saw this, it looked like an omelette. I don't know if it looks like an omelette, but yes, there's a clear space surrounding the nucleus. I'll think of an oligodendroglioma if it's a clear space, or a chromophobe RCC. In a bone marrow biopsy, I will think of a leukemia called hairy cell leukemia, also the same way, right? So this is how it looks. Okay, got it. Signet ring cells. We did read this when we were discussing neoplasia sometimes, right? It looks like a ring. It has a completely clear cytoplasm with a nucleus in the top. Looks like a ring. Signet ring morphology seen in diffuse gastric cancer. The reason for the link is mucin. Mucin is clear in appearance, so it looks like a ring, obviously, right? Signet ring morphology, fine. Okay, leaf-like. It exactly looks like a leaf. The only problem with this is once I remove the leaf, no, it will not look like a leaf. Okay, so leaf-like appearance. Leaf-like appearance is classically seen in Phyllodes tumor, right? It looks like a leaf when you have a leaf next to it, right? It's seen in classical in Phyllodes. Phyllodes, always the diagnosis should be clinical. A huge tumor in the breast, think of Phyllodes, fine. Okay. Indian file pattern. You see a tumor, it looking like red Indian slaves. You can see in the image. I'll come to it, Sarah. You see in the image, people are walking one behind the other. That I call it an Indian file appearance. Indian file appearance is seen in lobular carcinoma of breast. Sarah, diffuse gastric cancer undergoes metastasis to ovary, which I call it Krukenberg. So Krukenberg is a metastatic tumor. So the morphology will be like a primary tumor. If a gastric cancer goes to Krukenberg, I will have signet ring morphology. If this tumor, lobular carcinoma also can go to Krukenberg, will have your Indian file pattern, right? It's based on which spreads to the ovary, it has the pattern. Krukenberg doesn't have a primary pattern, right? How do you think this looks like? Your imagination. Let your imagination fly and tell me how this looks like. At least few places where it looks like what we read. It looks like a coffee bean, right? Amazing. A coffee bean appearance will be seen in Langerhans cell histiocytosis, or as an LCH, granulosa cell tumor of the ovary, and Brenner's tumor, right? These are three places where I have a classical coffee bean morphology. It looks exactly like a coffee bean, right? That's a pattern. Next, amyloid. We know amyloid, right? It's a pink deposit, extracellular deposit, no specific place. Let's see if how good your memory is. Tell me a thyroid tumor. Where do you think you can see amyloid? One tumor in the thyroid where you can see amyloid. Any one tumor in thyroid where you can see amyloid? Medullary carcinoma thyroid, amazing, right? So I can see them in medullary carcinoma thyroid. We read in your amyloidosis and also an insulinoma, right? So these are two tumors where I can see amyloid in microscopy. Just with amyloid, you can diagnose it. Because there's no other thyroid tumor with amyloid morphology, right? Perfect. Okay. Okay. Comedo necrosis. Comedo means tip or the center. So when you see necrosis in the central area of the tumor, I call it an comedo necrosis. And this is seen in a type of DCIS called as comedo DCIS. DCIS is the same ductal carcinoma in situ seen in the breast parenchyma. Central necrosis there. Fine. Great. Okay. Clear cells. Any tumor with clear morphology? Does it ring a bell? I'm sure you will be able to remember it. Clear cells. Clear cell renal cell carcinoma. One Hempel-Lindau syndrome, we just read in the essentials batch, and also your lipoma. Adipose tissue is clear. Obviously, lipoma has to be clear in morphology, right? Perfect. I have a name structure called Schiller-Dole bodies. The rest 4 of them might be definitely going over the head. Now itself, I know it's going over the head. Nayak, you won't confuse. I will tell the reason why you won't confuse a comedo necrosis with a granuloma, right? First, there will be a well-defined mass in case of a DCIS, right? So when it's you are not going to diagnose in the microscopy. Your thing with MBBS is you're just going to appreciate few MCQ points and few things which comes in slide, right? So you'll have a history there which is suggestive of a malignant tumor. And then when you look at this, it's not like a granuloma. It has cells here where you're not seeing epithelial morphology. You're not seeing giant cells. They are tumor cells, right? So that's a good number of cells surrounding a central necrosis, DCIS, right? Yes, DCIS has many patterns. 2 patterns I have shown you here, fine. Okay. Schiller-Dole body is seen in a ovarian tumor called as a yolk sac tumor. It can be seen both in ovary as well as testes. Looks like a glomerulus or called as a glomeruloid body, fine. Okay. Rosenthal fibers, just 2 more, just 24, that's all. When you see a pink elongated structure like this, I call them a Rosenthal fiber. It's a fiber, that's all. Fiber seen in the CNS. A tumor called as a pilocytic astrocytoma happens in the posterior fossa of the cerebellum, right? So that's where this tumor happens, fine. Great. Last but one, hi Pavan. So I have a condition called an Asopadi effect. So what you see in Asopadi effect is you see DNA surrounding the blood vessel. If you look at this, there's a blood vessel in the center. Surrounding that, I'm seeing blue color. Blue is nothing but nucleus, right? So blue color condensation surrounding the blood vessel, I call it an Asopadi effect. Hello Rahul, how are you? Okay, seen in any small cell carcinoma, especially for an undergraduate, I would say small cell carcinoma of lung, which is something which is very important. Okay, so the last but not the least, the triphasic morphology of Wilms. In Wilms, there will be 3 phases. You can see here A. Can I say that this looks like a gland? Obviously, this one A stands for your epithelial morphology. The C area is very, very dark, so I'm going to call it a blastemal morphology. The B area, it's pink in color, so it's a stromal morphology, right? There are 3 phases in Wilms. Which organ do you think you'll have Wilms? I'm also good, Rahul. You see them in kidney, right? So that's the 24th pattern, fine. So these are classical 24 patterns of neoplasia, fine. Let's see now how can we use this for diagnosis. I know that it's a bit difficult for you to remember everything, but still, let's take one organ and I want you to comment on the answer fastest finger first, right? Let's take CNS. I know for a fact you guys are in 2nd year. CNS tumor is something you must have never remembered about, right? Lion blastemal means blastomas, the immature component, small round blue cell morphology, right? So even if you don't know anything about CNS tumors, you can still say how it looks in microscopy. Let's start one by one tumor. Just let's take CNS for an example, that's all. Okay. Tell me what is the pattern for meningioma. If you have written, go back and say the answer, it's completely fine. But tell me whatever comes to your mind. You might be right, you might be wrong, doesn't matter at all. Pattern seen in meningioma. Perfect, right? Blue color. MKB, I have covered your slides in the essentials batch. Please have a look at them once. Perfect. Then world appearance. Meningioma will have world appearance, right? Amazing. World appearance and some more body. Super. Okay. Second tumor. oligodendroglioma. I'll go through the tumor if it's difficult for you to recollect, just to make sure that we have read. So if you know these 24 patterns, you can diagnose anything what's required for you. Oligodendroglioma will have this perinuclear halo or an fried egg appearance, right? That's one tumor. Third, glioblastoma, one of the blastomas without small round blue cell morphology, which had your palisaded appearance, right? Glioblastoma had palisaded appearance. We know that, fine. Okay. Ependymoma. Ependymoma is a tumor which comes from the ependymal cells of the ventricles. And ependymal tumors are little bit happening in the first or second decade. And ependymoma will have small round blue cell morphology. We have read about that. It might be a bit difficult to recollect now, but it's completely fine. Pilocytic astrocytoma. Which pattern? We saw it very late, right? Pilocytic astrocytoma. This pink color fibers, placental fibers. Medulloblastoma. It's ending with blastoma. So what's the pattern? Medulloblastoma, what pattern? Will have classically small round blue cell morphology, right? So the goal of this 24 images is very, very simple. For us to understand what is there in the microscopy. So if you have any doubt, do let me know. I'll try to explain. I'll try to explain that slowly, right? Okay. So these 24 patterns, like I said, stick in your front of your study table. Remember it, recollect it. Whenever you go to surgery or medicine or pediatrics, anyway, when you see read about a tumor, these patterns will definitely help you. You can easily diagnose them. It's not difficult at all. Fine. Okay. Randomly, I'll keep posting few questions on my Instagram asking what is the pattern and what you think of. Let's see how many of you can come on the right answer. Okay. Any doubt? Do let me know. Otherwise, we'll call it a day as usual. And I will share this PDF in the Telegram group and in my WhatsApp channel as well. Let's learn medicine and pathology the way it should be learned, right? Our goal is to try to excel pathology, not to crack your university exam or your NEET PG. That is byproduct of learning. Fine. All the very best, guys. Thank you. And for all the essential batch students, see you by 7 p.m. With RBC disorders. We're going to go to hematology today. Hopefully, we'll enjoy that journey as well. Fine. Thank you. Bye bye. Nayak Schiller dual body is this. It looks like a blood vessel in the center. Surrounding that, I have tumor cells like a glomerulus. So we call it Schiller dual body. Okay. Neat.